So this is about RH factor in third trimester considerations. So it's recommended at 28 weeks to do another antibody screen to make sure that an RH negative person, or everybody, but particularly an RH negative person, is not doesn't have excuse me, antibodies before giving prophylactic RhoGAM. The indications for giving that would be at 28 weeks prophylactically, because typically we don't know if the baby is Rh positive or negative. And the overall risk of someone becoming sensitized is like 16%. It's like 1 in 6, I think, will become sensitized if they do not do the injection. The risk of miscarriage, becoming sensitized, if you have miscarriage and do not get the RhoGAM, it would be 2%. Abortions by 20 weeks is 4 to 5%. So times that you would do RhoGAM injections, it's not just RhoGAM, that's just the brand name, but immunoglobulin would be after miscarriage, abortion, invasive procedure such as an amniocentesis, a disruptive procedure such as a external cephalic version, things like that. So that's, you would do a dose for those procedures depending on when they are done, but you're going to want to do the prophylactic at 28 weeks. And then if any of those issues happen during the pregnancy, you would do one. And then at 72 hours, within 72 hours after birth, if the baby is Rh positive, you would do another RhoGAM injection. And that's about 98% effective at making sure that people are not becoming sensitized after pregnancy. I think that was about it. The risk of not giving the prophylactic, I think I already mentioned, 1 in 6 people become sensitized. The risk of the RhoGAM injection, it's a blood product, so there is potential risk, very minimal risk. I don't even know that there's any there's not a lot of studies on what the RhoGAM injection can do to immune systems and things like that, so or childhood disease or anything of that nature. So it's hard to say what the risks are in totality, but the risks are very low. But the risk of becoming sensitized is 1 in 6, so that's quite high. I think that is about it. Another risk, given it at 28 weeks, it may not be effective long enough, so it may become metabolized quicker than in some people rather than others. And if the person goes past 40 weeks, then there's potential that you may need to give another dose before the baby's born.